Good morning, everyone. This is Megan Glass from OPWDD. Thank you for joining us today. Just as a friendly reminder, today's presentation will be posted to the OPWDD website within the coming days. Additionally, if you have any questions, please type them into the Q&A box below, and we will review those at the end of the presentation. And with that, I will pass it over to Allison McCarthy.
Good morning, everyone. Thank you so much for joining today's presentation. Before getting started, just wanted to communicate OPWD's gratitude for your continued commitment and dedication during these trying times. Obviously, a lot is going on, a lot to handle, and the work that you do and the dedication that you show day in and day out is critical, and we just wanted to thank you and make sure you understood that, we recognize your continued dedication and support. So with that, I will cover today's topics. We are discussing the return to day services and individual decision making. So as you know, the state of New York did reopen day services in July of this year, and Jackie Best from our regional office will be covering the published standards and where to find them during today's presentation. She'll be taking some time to communicate what has happened heretofore, and then we'll be turning to the importance of the individual decision-making process. I think as you can all recognize, as we confront decisions about returning to program, returning to school for potentially our children who are going back to school this fall, it's an individual decision. In a family, the person and their team must make decisions based on their comfort level and their assessment of risk. And we really want to just talk about that today and the importance of informed choice. So with that, I will turn it over to Jackie, who will be covering reopening of day services and the standards that have been set by OPWD and where you can find those standards.
Thank you, Allison. Good morning, everybody. So the reopening of day services is subject to rigorous standards with oversight from OPWDD. We know that everyone is concerned about COVID, and that is why we issued our rigorous standards. Our guidance document, titled Interim Guidance Regarding the Reopening of Day Services, certified by the Office for People with Developmental Disabilities, was issued on July 10th, 2020, and revised again on July 16th, 2020, and it is available on OPWDD's website, which is found on this slide. This is applicable to both site and community-based services, including day habilitation, pre-vocational, sheltered workshops, day treatment, and respite. There are 10 pages of standards and requirements to ensure consistency and the health and safety of the individuals served and their staff. The reopening interim standards address social distancing requirements, the use of mask or cloth face covering requirements, proper storage, usage, and disposal of PPE, symptom monitoring and COVID-19 exposure reporting requirements, proper hand washing and appropriate use of hand sanitizer, as well as transportation safety. OPWDD will be collecting the safety plans and attestations and will survey providers against the plans, but it will not be individually approving them. Once plans and attestations are submitted, a provider may begin delivering services as long as it can do so safely and in accordance with the guidance. So what would the surveyor be looking for with regards to safe reopening practices and procedures? This is addressed in the guidance. There is a paragraph in the guidance that states, OPWDD certified day programs may only reopen if they meet minimum state and federal safety requirements as outlined by the Centers for Disease Control and Prevention, Environmental Protection Agency, United States Department of Labor's Occupational Safety and Health Administration, New York State Department of Health, and OPWDD, while also meeting the minimum standards of the Americans with Disabilities Act. OPWDD guidance all relies on DOH and CDC standards, and employers are expected to comply with requirements set forth by OSHA and the ADA, without the need for OPWDD to outline specific requirements. There are not survey-specific checks against anything beyond OPWDD guidelines, but employers are always expected to comply with all the relevant laws and regulations. Please consult with your counsel if you have additional questions about what these may be. So what can we say about the day service safety plans? Individuals, families, and other caregivers and care managers must be able to make decisions about each individual's participation in day services. To that end, each day service must consider the individual's specific needs and circumstances to ensure they are able to participate to the largest extent possible. In addition, OPWDD day services must provide access to the day service safety plans so appropriate parties are able to review the plan remotely and without the need to specifically request each plan from the agency. To accomplish this, agencies are to post copies of the safety plans for each of their day services on their website. OPWDD requested that your agency's plan be available on your website, close of business September 4th, 2020. For safety plans yet developed, please post them to the website at the time of your submittal of the service safety plan and attestation to OPWDD. The agency must have to its ability to adhere to all requirements in the guidance as appropriate to the program and to ensure ongoing compliance with the requirements upon reopening. Any attestation is the filing of a written document with a government agency and is enforceable against the signatory. So let me just continue with one more piece before we move on to Allison.
Okay, great, thank you.
An important component of this process is the decision-making to return to day services. During the reopening of day program services, the decision on whether or not to return to a day program during COVID must be individualized based on the informed choice of the individual and/or his or her representative, and in conjunction with his or her care planning team. In accordance with OPWDD person-centered planning regulations in Part 636, these discussions should be led by the individual to the extent possible and desired, in conjunction with the support and facilitation of the individual's CCO and health home care manager. The full care planning team should be included in the discussion. Decision-making is based upon what is in the best interest of the individual and what the individual and/or his or her family representative wants and conveys during this meeting, not what is in the best interest or convenience of a particular program or provider agency. If the individual cannot express or convey his or her desires, the family member or representative makes the final decision based on this process. It should be noted that individuals can refuse a return to day programming, and if that occurs, the care manager should explore viable alternatives. They can also continue to receive day programming in their residence. Allison?
Thank you, Jackie. So now we really want to just turn to the importance of the informed choice of the individual. So on this slide, we share with you a resource that OPWD has available on our website that is called Risks and Person-Centered Safeguards. When making a decision with the individual and family, it is essential to consider the risks. Obviously, when considering to return to day program, it's going to be different for each individual, and the care planning team must make decisions about weighing the pros and cons and the potential risks. If a person-centered safeguard can help minimize the risks, then it may be appropriate to put in place a safeguard. Again, the decision to return to a day program is an individual decision using the person-centered process and involves the individual, representative, family, and full care planning team. The decision is based on what the individual wants and what is in his or her best interest. If the individual cannot convey his or her desires, the family member representative makes the final decision based on this process. So what are the real health and safety risks? Is there a risk for returning to day program? What are the benefits of the individual returning to day program? So it's weighing those risks and making a decision with the family and individual and working with the providers, if an individual has more than one, to make that decision. What are those considerations? What does the individual want to do with his or her day? How does the family, individual, and or representative feel about returning to program? What are the benefits of returning to the day services for the person? As I mentioned earlier, it's going to be different for everyone. It may not be time, and you may not feel comfortable returning to program, but it's possible that if you consider what safeguards could be in place, for example, we've all had to learn what it means to social distance and how to remember to social distance when we enter the grocery store or go to any other community setting. Can the care team or the individual and their support group learn how to understand and think about social distancing? Are there options to achieve a safeguard and return to day program? Once a decision is made, then it's important to consider the safety plan. Does the safety plan need to be updated to include those safeguards for the individual? And it's also important to discuss with the care team, including provider, maybe residential, maybe also day, and the care team about returning to program and those safeguards in place. In addition, it's important to consider other individuals in the day or residential setting that may impact the individual's decision-making or need to take into account upon the return to day program. So it's not only the individual's personal risk, but what it means to interact with other individuals in programs. And again, all of these considerations need to be discussed with the individual, family, and care team. So what can an individual and family do prior to having a discussion and thinking about that return to day program? As Jackie mentioned, the safety plans for each provider who is open is posted to their website. It's important to read that safety plan and make notes about what concerns you have about that safety plan. Write those down, have them available and readily discussed when you have a discussion with the care planning team. Make a list of your questions. How do you address each of those questions and discuss that with the team? So let's turn to the care manager role. The care manager role is to facilitate and coordinate the planning discussion. So with as much as possible, the full care plan team available for the discussion to talk through and identify the individual and family's interests, and to support that individual and family in communicating those interests, concerns, or questions. Prior to that discussion, important to gather information from providers and the individual and family about the person's thoughts and concerns, and then supporting that informed choice of the individual. So again, that care manager role is to ensure that the person's decisions are executed based on their interests and really comfort level in terms of returning to day program, and that those safeguards are included in the care plan, and following that decision, a monitoring of that decision and a review of what's happening once the decision is made. So for the individual, an individual and family can really prepare for the meeting or discussion, and it's important for them to lead and participate, and the care manager can support that happening, and really communicating with the care manager prior to that discussion what he or she wants or what their concerns might be. Maybe to listen and help outline benefits and potential risks for returning to the day program is really, I think, the most critical piece when you're thinking about returning to program. What makes you nervous as a family? What makes you nervous as an individual about returning to program? And it may be that it's too soon, or it may be that a safeguard needs to be put in place. Some education and training, again, about social distancing could be helpful. So it's really going to depend and vary from individual to individual. So if we think about the roles of the provider, both residential and day, it's critical that there's participation in these discussions, because if there isn't necessarily agreement or a decision hasn't been made, we need to hear from each other and be available to answer and address questions or concerns. Providing all needed information to support the informed choice and decision-making is critical as well. So once decisions are made, to implement needed safeguards and document them in the care planning record is essential so that they can then be monitored. It's up to the providers to execute the decisions of the individual and to support those decisions effectively. Providers should be following up on the interim guidelines for reopening and making sure that any updates to those guidelines are updated and communicated, and monitor the individual safety and care safety plan. If needed, and if there are questions, the provider should be following up with the care manager and vice versa with the individual to address any challenges that are happening or any new risks that emerge. So again, it's so important for the conversation to be happening between providers, individuals, families, and care managers to make an individual decision about returning to program. Some programs may not be open, so then a decision has to be made. What other available options are there, and can the individual and family think through and talk with the care managers what those might be. We've provided on this slide some additional safety information and guidelines and resources that are available. I think you've probably seen many of these. Department of Health website for resources, our CDC resource, and Occupational Safety and Health Administration website. So with that, we will pause and review questions that are coming in. Again, we want to thank you for your time and attention, and take a moment to review those questions.
All right, so we're going to dive into some questions. The first one being, does a team meeting need to occur prior to the person returning to the day program?
Great question. So the question again is, does a team meeting need to occur? And it's really individualized. If a decision hasn't been made and there needs to be a discussion with the care team, then a care team meeting should be convened. It can be convened using the flexibility of telehealth, as we have used since the inception or since the beginning of COVID. So there can be a technology supported conference with the team. But again, some people may have returned without the need for a full care team meeting, but in some cases, to discuss the importance of safeguards and make sure those safeguards are covered, and or if there are just things that need to be talked through between the provider, the care manager, the individual, and other members of the team, absolutely appropriate to convene the team and have that discussion.
How can individuals continue to receive day hab services while still at home if some providers are unable to continue providing equipment for telehealth services?
That's a good question. So if the individual is remaining at home, it's important for their provider to support them using the flexibilities that were approved in the K. And the ideal is that that provider would be able to provide the technology needed to access communication between the habilitation staff and the individual. If that's not happening, we can certainly support a conversation, and that would be referred to the care team, and that's where the care manager would support resolution and finding solutions to any potential issues that may arise. But there are flexibilities that allow the provision of services from home and other locations if the individual is unable or has made the decision not to return to the site, or the site, is not available for reasons of health and safety.
Can an individual return to day hab for, say, only 1 to 2 days a week instead of going daily? And will the day hab have to accept that schedule?
Absolutely, absolutely. So the individual can make a choice about their array of services and how frequently they attend the day program. So as mentioned earlier, it's a person-centered planning process that needs to take place, and the individual and their loved ones need to determine what their comfort level is and make decisions. We do recognize and identify that we may not look exactly like we looked prior to COVID, even at the end of COVID. It may mean that you have to make a decision to change up the way you receive day services on a weekly basis, and that is appropriate, and the care team planning process should discuss and make those decisions collectively.
What other options are available for a person if they themselves do not want to return or their family does not want them to return to the day program?
So that's a really good question to discuss with your care manager. I think we're all collectively looking at what the future of day service delivery may look like following this COVID emergency. I think it's important for you to have that discussion with your care team and identify what you really would like to do, what makes you comfortable, where do you feel safe, and then it may be appropriate to have that discussion with your care team and revise your life plan goals.
What can a care manager do if an agency is not allowing people who reside in certified residences to return to the day program when that person wants to return?
Again, I think that's one of the primary reasons why we wanted to communicate today's information. The care manager and the individual should be talking with the providers and having a discussion about that decision making. In some cases, there may be a day program that's not yet open, and that return to the day program would not be a viable option, and the individual and family could look at alternative options. But if the day program is open, then it's important to talk to that provider about potential return and what safeguards would need to be in place to then return to the day program.
Is a team meeting required for everyone returning to a day program, or for only those who have questions or are unsure about returning?
The life plan or plan of care meetings should continue to occur according to the schedule that the individual has in terms of the annual and semi-annual review. So those, of course, are required. The decision to convene the team for the specific goal of making decisions to return to day program is a decision that the individual and their loved one should make. If you want to discuss what that looks like and ensure that the team is on the same page, then absolutely convene and have that discussion, but it is not required.
And must that meeting be documented if it does occur?
Absolutely. The care manager's role is to document all activities supporting the individual's care. So we would expect that meeting be recorded in the care coordination system and that record of the discussion occur.
Many agencies have limited to-from transportation from day program, which has made it hard for many participants to be able to attend. Will this be a long-term change for families moving forward?
Jackie, do you want to take that one?
Sure. So in reference to transportation, all-day programs have a piece of funding in their rate to cover the transportation costs. So it's OPWDD's expectation that if you've got individuals who are attending the program, you should be providing the transportation to and from. If a family does not want to have their loved one be on the buses or the vans of the provider, they are welcome to provide that transportation. But if they can't, the day provider should be ensuring that transportation is available. Regarding how long this is going to continue, until such time we have more information of direction regarding, COVID, it will continue for the foreseeable future.
Thank you, Jackie. Some people have already returned to day program prior to this discussion, so how should that decision-making process be documented or handled if needed?
If the individual was able to make a decision and return to a day program, then, it really doesn't need to be reflected as a decision point. They were able to make a decision with their family or loved one or representative, and that's fine.
It was noted that individuals may choose to receive day services in their residence. Does that apply to certified residences as well as private homes?
Yes, it does. As you may recall, we have in the Appendix K, Community Hab Residential. That allows for day community hab to be delivered in a certified setting. So that's absolutely appropriate and is happening, particularly in instances where it may not be safe for the individual to return to the community due to high-risk status.
Should care managers be completing a safety template for services that were not forced to shut down, such as home respite services?
Jackie, do you have a thought on that one?
I'm sorry, Megan, can you repeat it again?
Certainly. Should care managers be completing a safety template for services that were not forced to shut down, such as respite?
Actually, I think, answer that. I don't think where you need to think about safety and how to address safeguards is through updates to the life plan. If the changes in the individual services result in changes to safeguards for the individual, regardless of the service, it must be reflected in the life plan.
For the individuals returning to day program, will their care manager need to complete an addendum to the life plan?
So an addendum, COVID addendum, is specific to the two provisions in the K, so Community Hab R and the Retainer Day program. So if the individual is participating in services via those two flexibilities, then the COVID addendum is the appropriate place of documentation. If the individual's change in service or decision to receive services is outside those two programs, then an update to the or a revision or a communication with the regional office or authorizing services would need to be approved, and then the life plan would be updated to reflect that new information. If they continue to receive the services that are in their current life plan, it does not need to be updated. I think it is important to have a process internally for denoting modifications to the individual's delivery of services. I expect that's happening because you, as the care manager, have been following up on a regular basis with the individual and how they're accessing services and or perhaps not accessing services. We do recognize that many have made the choice to continue to remain in place due to the crisis and their comfort level. So it's really, you know, I think incumbent upon the CCO care manager to continually keep records of their communication with the individual and their family to document how things are happening and how decisions are made throughout the throughout this time.
If an individual or a family member decides to stay home and not return to day services, whose responsibility does it become to provide day programming at home for that person?
So again, the individual and family should work with the care manager and the care team. If you are making the decision not to return to the site, you can have a discussion with your provider about the options and available flexibilities in the K, for example, receiving Community Hab at home. So that conversation should be happening. You may make decisions not to engage with that provider. If you are looking for alternatives, you would need to work with your care manager to identify what those are and go to the regional office for authorization of services. That said, it may not be from an OPWD provider, or you may have alternative opportunities for support through your community.
Allison, can I add on to that?
Absolutely.
So it should also be noted that if for one reason or another the family and individual do not want to return to the day program that they were authorized to attend, they do have the opportunity to switch providers, assuming that the other provider, the new provider, has the capacity within their program to serve an additional individual. And the way that the care manager would effectuate that change would be to submit a service amendment request to the regional office for a change in provider. But I do want to stress that the new provider must have vacancies or capacity within their program to serve the additional person.
re-explain if day hab programs are required to provide transportation to from programs?
Sure. So within a day provider's rate, there is an add-on for transportation. Because they are being reimbursed for the transportation, it is OPWDD's expectation that they will figure out what needs to be done in order to transport the individuals who are currently returning to program. If that can't be accomplished, the providers can certainly speak with families about providing the transportation themselves. However, if the family is not able to do that and they need the provider to be able to transport their loved one to and from program, it is our expectation that the provider will figure out a way in which to do that. Hopefully that's clear.
Thank you. I'm just reviewing some additional questions. If a residential agency isn't allowing an individual to attend an outside day program that is opened, is there a way care managers can help advocate for that individual, or is it the resident's decision?
So again, I think it is not the resident's decision. It's the individual and their team's decision. If you have conducted a discussion with the team and you cannot agree on a resolution, then it's appropriate to reach out to your regional office for support.
If a person chooses to continue to receive services at home, can that plan continue long-term, or is there any sort of phase out of that?
So the flexibilities in the Appendix K are currently approved. That specific flexibility is approved through March 31st, 2021. That is the point at which the 1915K Appendix ends, but we are looking at including provisions in our amendment, so our comprehensive waiver amendment. That's what all states have been directed by CMS to do, is to consider what flexibilities we have in the K and roll them into the comprehensive waiver to continue forward. We're currently discussing internally and have activities with stakeholders, including recent focus group discussions and other advocacy group discussions, to identify what flexibilities have been helpful and working, and that we will continue to carry forward upon CMS approval of our comprehensive waiver.
In a case when someone becomes infected with COVID-19, how many infected individuals does that program, how many affected people will cause that program to close?
Jackie, do you have a thought on that one?
I think, I mean, my own thought is that that is a discussion for the agency with the local Department of Health, because contact tracing will need to take place, and if significant contact has taken place between the infected individual and others within the program, those individuals and the staff are going to have to be quarantined. But again, that's a discussion with the Department of Health. So if people within the program have not, were not exposed to the infected individual, I do not believe that the entire program will have to close down. It depends on the, face-to-face contact with the infected individual.
I'm just going to pause for a moment, so you will hear silence as we continue to review some additional questions.
Hi everyone, Allison McCarthy here. We continue to receive several questions that relate to provider support for an individual's decision to return to program. We conducted this webinar recognizing that it is a very difficult time and these decisions are very difficult. Providers are strained, providers are stressed, and so are individuals and family members as well as care managers. We have to do our best to come to the table together to have a discussion that puts the person and their needs first and try to reach agreement on the decision to return to day program. Where that cannot be achieved, the regional office has available resources to support that, that resolution. It is absolutely appropriate and mandated that for individuals who are members of the Willowbrook class, that the Willowbrook parties participate and support the decision around return to day services. This is not a black or white decision in terms of that return to day program. I think you and I can all recognize that even for our own family members where we or ourselves who have to make a decision to return to work, to send our child to school, to you know, even perhaps do simple things in the community. It's a personal choice and one we have to weigh on an individual basis. We appreciate your continued advocacy, and we ask that you guys, that we all work collaboratively and collectively to support these decisions. They are not easy, but we wanted to take this opportunity to talk about that informed choice, the balance of risk, how do we support those decisions, and it may take more time. You may not have the decision you're looking for today or tomorrow. It may take another week or two, and we have to continue to monitor how things roll out across the state in terms of this pandemic. So we've tried to put in flexibilities, and again, the regional office can support discussions that can't be moved forward. So that is where we sit today. It is not easy. We don't have all the answers. And we, again, appreciate your continued support, dedication, and collaboration. It's hard to work across the aisle sometimes when we're trying to support our agency and support our jobs. We have to listen to each other and be compassionate and be patient. So we want to thank you for your time today. We want to thank you for your efforts, and we will do our best to continue to communicate what we can as immediately as we can. And with that, we are going to close today's conversation. Thank you to Jackie, Megan, our cheerleader over here, Kate, and other staff who have supported the convening of this webinar. Again, thank you and have a great morning and afternoon.